Heart failure by Angela Cerrone. Heart failure can be known as congestive heart failure, CHF, which is a chronic disease in which the heart doesn't pump blood as well as it used to. Heart failure affects about 6 million Americans, and it's the leading cause of hospitalization in people older than 65 years old. The systolic heart failure, less blood pumped out the ventricles. Weakened heart muscles cannot squeeze as well. Diastolic heart failure, less blood fills the ventricles. Stiffened heart muscles cannot relax normally. When to see a doctor. When you are experiencing rapid or irregular heartbeat associated with shortness of breath, chest pain, or fainting. Sudden severe shortness of breath and coughing up pink foamy mucus, chest pain. When that happens, you should call 911 or let somebody take you to the hospital. Once you're at the emergency room, the healthcare providers will stabilize your condition and will tell you if it was a heart failure or another thing. Risk factors. High blood pressure. The heart works harder than it has to if a person has high blood pressure. Diabetes medications. Some medications for diabetes can increase the risk of heart failure in some people. Diabetes, it can damage nerves and blood vessels. Obesity can cause plaque and it narrows or blocks the coronary arteries. Irregular heartbeat. It's when the heart has an abnormal rhythm. For example, if the heart is beating frequently and fast, it can cause the heart muscles to weaken and cause a heart failure. Alcohol use. Drinking too much alcohol can cause the heart muscles to weaken and lead to heart failure. Causes. It's caused by many conditions that affect the heart muscles. Most people who develop heart failure have had another heart condition first. Kidney disease, heart defects that present at birth, heart attack, when the coronary artery becomes suddenly blocked and blood cannot flow to the heart muscles. Congestive lungs, fluid backup into the lungs can cause shortness of breath with exercise. Smoking cigarettes, poor diet/nutrition, excessive alcohol. Symptoms: shortness of breath, fatigue and weakness, rapid or irregular heartbeat, reduced ability to exercise, lack of appetite and nausea, swelling in your legs, ankles, and feet. Treatment: surgery and medical devices. Coronary bypass surgery is a surgery done on blood vessels from your leg, arm, or chest. Bypass a blocked artery into your heart to allow blood to flow through your heart more freely. Heart valves repair or replacement. Surgeons can repair the valve by connecting valve leaflet or by removing excessive valve tissue so that the leaflet can close tightly. Role of a nursing assistant. Weigh resident as instructed, lifting, turning, and feeding patient, answering call light, assist resident as needed, measure intake and outtake, assist with range of motion, assist with personal care and activity of daily living, take vital sign, blood pressure, respiration, pulse, temperature, apply elastic leg stocking as ordered to reduce swelling in feet and ankle. Why is it important? The role of a CNA. It's important to take the vital sign because it can determine if the patient is doing well with treatment or if he has something wrong. Always answer the call light as soon as possible because you don't know what the patient needs, so you need to go assist him. Personal care. It helps because the patient is clean. Religious factors. Christian people rely upon their own prayers for God to cure them. Therefore, they don't get help from doctors. Christians don't allow certain medication procedures. Christians are not allowed to get blood transfusion. Christians don't also allow surgeries because they rely on prayers, not on medicine or doctors. And those are my sites.